Our next presenter will be Catherine Del Mundo. Catherine Del Mundo is a retail food specialist for the FDA National Retail Food Team from the Office of State Cooperative Program. She provides assistance to Arizona state, local, and tribal regulatory agencies. Prior to FDA, Catherine served as an environmental public health officer for the Guam Department of Public Health and Social Services from 2011 to 2020 and oversaw the food safety program. She served as the lead for the Voluntary National Retail Food Regulatory Program standards and the standardization of food safety inspection officers for Guam.
Good afternoon, everyone. So today I will be presenting the results of the data collection that FDA conducted for the retail food store Deli during 2015 to 2016, which is the first data collection period of FDA's current 10-year study, which is from the 2013 to 2024. So this is the baseline data to be used to assess trends in the occurrence of risk factors for future data collection, specifically for Deli. So the previous 10-year study that was from 1998 to 2008 provided a solid foundation for developing a national retail food program model, and moving forward, FDA developed a new model. So today I will be discussing the retail food store category of the study. The overall study also includes several other segments of the retail food industry, such as full service and fast food restaurants and institutions such as hospitals, nursing homes, and schools. So our objectives are to identify the least and most common occurring foodborne illness risk factors and food safety behaviors or practices in retail food stores within the United States. We also wanted to determine the extent to which food safety management systems and the presence of a certified food protection manager would make an impact in the occurrence of food safety behaviors or practices. We also wanted to determine whether the occurrence of food safety behaviors or practices in retail food stores differs based on an establishment's risk categorization and their status as a single unit or multi-unit operation. The intent of our study and what we wanted to use the results of our current 10-year study period will be used to develop retail food safety initiative policies and targeted intervention strategies that's focused on controlling foodborne illness risk factors. We also wanted to provide technical assistance to state, local, tribal, and territorial regulatory professionals, as well as identify FDA retail work plan priorities and inform FDA resource allocation to enhance retail food safety nationwide. For communication, outreach, and education, there are many new products that have been developed to be more proactive in our outreach and communication or education efforts. So I will be going over those innovative products in detail during the presentation. So based on the study model, Deli department or operation is one of the facility types collected under the retail food stores industry segment. So this table provides the description of how Deli departments qualified as being eligible for being included as part of the study. So delis that were not associated with a retail food store, meaning they were standalone types of establishments, were not included in the study. For the risk category, establishments eligible and selected for the study fell into risk categories 2 through 4, as you can see here. And this is basically defined in the Food Code Annex 5, Table 1, since establishments that fell into these categories represent more complex food operations, such as cooking, cooling, storage, and reheating. So this allowed us to have a chance to observe the behaviors and practices that we wanted to capture for this study. So for sample size, FDA's CIFSAM Biostatistics branch determined that a minimum of 384 data collections were needed during the initial baseline data and subsequent data collection periods. So this sample size provides a sufficient observation of food safety practices to be 95% confident that compliance percentages taken from the data collections are within 5% of their actual occurrence. So for this study, FDA was able to achieve a sample size of 397 data collections. So just a little background of our procedure. For data collectors, we had 22 FDA retail food specialists at that time that conducted site visits throughout the United States at randomly selected retail food stores to perform the data collections. Now, before data collections would occur, all specialists receive customized training specific to the study data collection protocol and marking instructions for the standardized data collection tool. So in addition to that, FDA CIFSAM personnel standardized the specialists in applying and interpreting the FDA food code. So basically all the specialists possessed the technical expertise in retail food safety and had a solid understanding of food service operations within the retail food store industry. For facility selection, FDA used a GIS database that had a list of businesses that were used as the establishment inventory for the data collection. So specific establishments were then randomly selected to participate in the study from among all the eligible establishments located within a 150-mile radius of the home locations of the 22 FDA retail food specialists that were doing the data collections. So this picture in this slide depicts the sample coverage for the study. So this slide provides information on the study protocol and methodology that FDA used. For determining eligibility, FDA would initially contact the state or local jurisdictions that had a regulatory responsibility for conducting retail food inspections before a data collection by FDA specialist was conducted. So the specialist would verify that the selected facility was placed in the proper risk category and through discussions with the regulatory authority determined whether the facility was under any legal notice. Now, if the selected retail food store was either under a legal notice, they were closed or misclassified, the specialist would not conduct a data collection at that establishment and instead a substitute was randomly selected. So as part of the initial contact that I mentioned with the state or local regulatory authority, the specialists also obtain information pertaining to the agency's retail food program, such as whether or not they were enrolled in the FDA retail program standards, timing of regulatory inspections, current grading systems, their protocol for posting inspection results, manager certification requirements, if there are any required food handler training. So each specialist also extended an invitation to the state or local regulatory agency representative to accompany them during the data collection. Now, for the actual data collection, the specialist conducted unannounced non-regulatory visits to each selected retail food store. Once they arrive at the establishment, the specialist would explain the purpose of the visit to the owner or to the person in charge and provide an introductory letter that explained the purpose of the data collection. Now, if the owner or person in charge elected not to participate in the study, the data collection was not performed and a substitute facility was randomly selected to replace the one that opted not to participate. Okay, so next let's talk about the data collected for this study. So our entire data is centered around the foodborne illness risk factors that's identified by CDC, or basically food preparation practices and behaviors that directly contribute to foodborne illness. So these risk factors can be controlled or prevented with appropriate behaviors and practices, which would then in turn prevent foodborne illness. So on this slide, you'll see a table of those risk factors, as well as the associated data item. So the observations and or measurement of the food safety practices or behaviors associated with the occurrence of foodborne illness risk factors are the primary data items that's collected for the study. So for example, for poor personal hygiene risk factor, it has two primary data items associated with it: employees practicing proper hand washing and not touching ready-to-eat foods with their bare hands. So as you may have noted, just by looking at this slide, the data items are written to reflect positive behaviors and are also written in layman's terms and not regulatory terms. So this change from FDA's previous study, where the data items were written as poor behaviors and in regulatory terms, was changed. And that's when FDA worked with the National Restaurant Association on this change to facilitate effective communication of the study results. So another thing you may have noticed, the table in this slide only includes 4 out of the 5 foodborne illness risk factors. It does not include food from unsafe sources as part of the 10 primary data items. So while this is still an important risk factor, FDA study design did not include this risk factor under the primary data items because the agency observed low out of compliance percentages in previous FDA studies that was conducted in the past, and also inspections conducted by regulatory partners substantiated these findings. So not in this slide. In addition to the primary 10 data items that you see here, there are also 9 additional data items that assesses food safety practices and procedure that directly support active managerial control, and data related to food source is collected in this section. So all in all, the 5 foodborne illness risk factors are included as part of the study design, with one of them being listed under the heading Other Areas of Interest. Okay. So next, let's go over the information statements for the primary data items. So under most of the data items, a list of information statements are provided. So these information statements are preceded by a letter for organizational purposes and describes a specific observation associated with the overarching data items it's listed under. So using the example we have on this slide, for data item 9, which is raw animal foods are cooked to required temperatures, the information statements for the data item are listed in statements A through F. So originally in FDA's first 10-year study, many of these information statements were included as part of the actual data item. So that's a lesson we've learned from the previous study. If you get too specific in your food safety observations, you often are unable to obtain enough observations of the practice to draw statistically significant conclusions. So, for example, the information statement under E talks about the final cooking temperature of roast. So that means data collectors would not only have to visit establishments that have roast on the menu, but actually be present at the precise time the roast had completed the cooking process in order to obtain an observation or measurement of the final cooking temperature. So for the current study that we now have, this decision was to focus on the overall data item for analysis, which provides a better foundation upon which to draw statistically sound conclusions. So next, I'll be discussing the report and its risk factors, data items, findings, and the next steps for the rest of the presentation. But for time's sake, here is the bottom line up front. So of the food safety behaviors or practices investigated in this study, delis had the best control over making sure no bare hand contact with ready-to-eat food happens, and raw animal foods are cooked to the required temperature. Now, there remains a need to have better control over the following food safety behaviors and practices, and they were employee hand washing, and this includes both when to wash and how to wash properly, cold holding of foods requiring refrigeration, and proper cooling of foods. We also found that food safety management systems were the strongest predictor of the compliance status of data items. So as an establishment improved the development of its food safety management system, the average number of primary data items out of compliance was reduced. Also, delis that had a certified food protection manager who was also the person in charge at the time of the data collection had stronger food safety management systems and in turn had less out of compliance observations. So this suggests that having a certified food protection manager who is also the person in charge and present for all hours of operation enhances their food safety management systems, leading to a reduced average number of primary data items that were out of compliance, and ultimately resulting in the reduced occurrence of foodborne illness risk factors. So as I described previously, establishments eligible for study selection fell into risk categories 2 through 4, since again, these food establishments represent more complex food operation and activities and allowed us to observe the behaviors and practices that we wanted to study. So additionally, the deli had to meet our definition to be included in the study as outlined in the study protocol. So if it was a standalone sandwich shop or delicatessen with no other retail food operation, it wasn't included in the data collection. So here's the risk categories of the 397 delis that were sampled. So 48% or 192 establishments were risk category 2, 47% or 185 establishments were risk category 3, and 5% or 20 establishments were risk category 4. So the number of establishments that were risk category 4 was particularly interesting because we don't usually think of a retail food store deli as a risk category 4. But there were some establishments that chose to put the deli department in charge of the hot bar or other operations where special processes such as juicing or making sushi occurred. So when this happens, there is an opportunity to observe high-risk behaviors, which was interesting in our data collection. So we also analyzed if there were any effects on data items that were out of compliance based on the facility's status as a single unit, which is your one operation, like your mom and pop type of independent establishments, or multi-unit, which consists of 2 or more locations, like a chain or a franchise. Again, this was to test our hypothesis that multi-unit facilities may have better control over foodborne illness risk factors due to the type of infrastructure and communications or resources these types of operations had. So 74% of the samples were part of a multi-unit operation. And again, this is somewhat what we expected to find based on our exclusion and inclusion criteria. So before we get to the results, here is the formula used to report the data. So percent out of compliance observations for each data item represents the proportion of establishments where that data item was found out of compliance. So we got this by dividing the total number of out of compliance observations by the total number of in and out observations for the data item. So again, one thing to note too is that the data reported is a proportion and not a rate. So for example, if the data shows 80% out of compliance for the proper cooling of foods, this means that there was at least one observation of improper cooling of foods in 8 out of 10 establishments where cooling of TCS foods was observed during the data collection. The 80% score should not be interpreted to mean that foods were not cooled properly 80% of the time. So for those that are just starting up a risk factor study, there is a database that you can use for free for your own risk factor studies that will perform these analysis for you. And I'll provide more info on that later. So next, this figure illustrates our primary data items, which are 1 to 10, which represents the food code interventions that address the risk factor. So data items 1, 5, and 7 were found out of compliance most commonly at 72.1%, 70%, and 62.9% respectively. Data items 10, 2, and 9 were found out of compliance least commonly at 17.2%, 5.5%, and 4.8% respectively. So this suggests that while delis are better at managing bare hand contact with ready-to-eat foods and making sure foods are cooked to the proper temperatures and reheated properly, there remains a need to gain better control over cooling, cold holding foods that require refrigeration and employee hand washing. So particularly in delis, it's important to note that there are 2 types of cooling that are prevalent. So you have ambient cooling for ready-to-eat products. So you think about sandwiches and salads, and cooling of cooked foods. So we did collect both kinds of cooling data, as well as whether proper cooling methods were used. So there's a lot of additional information that's available in the technical report and top-line summary on this data, which I will go over later. So now that we went over the findings on data items collected, I want to discuss the next characteristic analyzed in the study, which is the food safety management systems, or FSMS. So we wanted to see if these systems impact the occurrence of foodborne illness risk factor. So a food safety management system refers to a specific set of actions and or procedures to help achieve active managerial control. Now, while FSMS vary across the retail and food service industry, the purposeful implementation of procedures, training, and monitoring are consistent components of a food safety management system. So for the purpose of this study, there are 3 key elements that were used to assess a deli department's food safety management system. So the first one is procedures. So procedures are a defined set of actions for accomplishing a task in a way that minimize food safety risks. Next, we looked at training and what is the process management is taking to inform their employees of the food safety procedures and teaching employees how to apply them. And then finally, we have monitoring, which is the routine observation and measurements done to check if food safety procedures are being followed and maintained. So taken collectively, these elements are referred to as an establishment's PTM rating. So during the data collection, the data collector assesses each deli's food safety management system to determine the extent to which these systems were developed and implemented in the deli to control one of the 4 foodborne illness risk factors that includes the 10 primary data items in the study. So the risk factor for which a food safety management system assessment was conducted in each deli was also randomly selected. So the criteria for rating a facility's food safety management system focus on determining if management was able to describe and identify the critical limits for the specific risk factor procedure or practices as they apply to the deli, the steps or tasks that are performed to ensure the identified critical limit for the specific risk factor procedure or practice are achieved, if they were able to identify specific employees that have been assigned the responsibility to correctly perform the steps or tasks, and produce written materials or standard operating procedures, posters, wall charts, wallet cards, you name it, that support implementing the system to control the specific risk factor procedure or practice within the deli. So based on management's response for each of the area described, the data collector used a standardized system to rate each element. So here are the descriptions of what each of the food safety management score means. So this study calculated a single overall PTM rating for each deli by adding all individual PTM ratings for each data item and then dividing that number by the number of individual ratings that are given. So this food safety management system score can be treated as a continuous variable with possible values ranging from 1 to 4 and is categorized by 1 as being non-existent, scores higher than 1 but less than 3 as underdeveloped, scores of 3 but less than 4 as well-developed, and scores of 4 as well-developed and documented. So to illustrate if the poor personal hygiene, for example, if we use an example of a poor personal hygiene risk factor, was selected as the area for the data collector to conduct to assess their food safety management system, then a separate evaluation of PTM would have been conducted for data items 1 and 2 that's related to the risk factor. So shown in this first table, a rating would be given to each element for each component of the PTM. So as shown here, we then take the values for each element, add them together, and divide them by the total number of elements that were evaluated. So we come to a PTM value of 2.5. So in the last table here that you can see, a value of 2.5 means this particular deli's food safety management system for poor personal hygiene will be given a description of underdeveloped. So here's the results of our food safety management system analysis. So of the 397 delis sampled, 12.2% had non-existent FSMS, 56.1% had underdeveloped, 25.8% had well-developed, and 5.9% had well-developed and documented. So combined, about 32% had well-developed or well-developed and documented food safety management systems. So remember, the only difference between well-developed and documented is that there are written procedures which could ultimately improve sustainability over time. So not in the table, but of note, 40.4% of multi-unit establishment had well-developed and documented systems as compared to 6% of single-unit establishments that had well-developed and documented systems. So this illustrates a significant difference in systems between multi-unit and single-unit operations. So we generally understand this to be true due to the ability of multi-unit operations to have more developed SOPs and general infrastructure and resources. So next, let's discuss the findings related to food safety management systems supported by the data analysis. So first, food safety management systems were the strongest predictor of data items being out of compliance. So those delis with well-developed food safety management systems had significantly fewer food safety behaviors or practices out of compliance than did those with less developed food safety management system. So the bar graph in this slide indicates that delis with non-existent systems average 4.6 data items out of compliance, while delis with well-developed and document systems average 2.4. So on the average, that is more than 2.5 fewer data items out of compliance. Here's the results of the Certified Food Protection Manager. So during the data collection, the data collector would obtain information about the scope and type of food protection manager certification attained by the deli personnel. So an assessment was made to determine their status. So with a status of none, this meant there was no certified food protection manager present in charge or employed. For employed, a CFPM is employed by the company, but not necessarily present at the time of the data collection, which would mean no one with knowledge and authority is in charge when food was being prepared during the time of the data collection. For present, it meant a CFPM was present, but not necessarily the person in charge, which would mean that they have no authority to make appropriate interventions. And for person in charge, this meant a CFPM was present and was the person in charge. So for each area listed above where deli personnel provided a yes response, the data collector would also make an attempt to verify the response by requesting to view a copy of their certificate. So of the 397 delis evaluated or observed in the study, 33.5% had no CFPM employed, and 51.1% had a PIC that was present, and a CFPM, which is what we wanted to see per the food code. So this slide provides the median primary data items that are out of compliance across all our observations. So highlighted, you'll see the median of 4. So for our data, the median is the best measure of where the middle of the data occurs. So in our observations, we would typically see at least 4 out of the 10 data items out of compliance in the deli. So this is one of our major metrics within the study to allow us to show if foodborne illness risk factor occurrence is changing over time. And what we hope to see in future data collections is to see a shift to less than 4, which will show an increase in compliance. So in conclusion and in summary, we found that of the food safety behaviors or practices investigated in this study, the delis had the best control over, again, making sure no bare hand contact with ready-to-eat foods happened, and raw animal foods were cooked to the required temperature. Now, there remains, again, a need to get better control over food safety behaviors and practices such as employee hand washing, again, which includes both when to wash and how to wash properly, cold holding of foods requiring refrigeration, and cooling foods properly. So we also found that food safety management systems were the strongest predictor of the compliance status of data items. So basically this meant as the establishment improved the development of its food safety management system, the average number of primary data items out of compliance were reduced. Also, delis that had a certified food protection manager who was also the person in charge at the time of the data collection had stronger food safety management systems and in turn, less out of compliance observation. So this suggests that having a certified food protection manager who's also the person in charge and present for all hours of operation enhances their food safety management system, and the average number of primary data items out of compliance was reduced, and this resulting in the reduced occurrence of foodborne illness risk factors. So I've mentioned before, there are many new products that have been developed by FDA work groups to be more proactive in our outreach and communication or education efforts. So the first is the Topline Summary. So the Topline Summary was developed as a means to provide more of the data not included in the technical report. So we get requests frequently for all types of data collected in the study, such as temperature observation, distribution, and the secondary data items. So the Topline Summary provides these info in case it's something you are interested in. So this summary is formatted to be accessible and easily digestible to provide the data to anyone who wants to take a closer look or draw their own comparisons or do their own independent research. Next, we have the Food Safety Management System, or FSMS fact sheet, which is a 2-page document that explains what is a food safety management system, how they impact foodborne illness risk factors, and what we found in this data collection. And it's basically a continuing document from the restaurant data collection that was conducted in 2013. So this fact sheet provides the key points discussed that I discussed during this presentation. So overall, the document was very well received, and the feedback that FDA received was that there was an interest in providing this fact sheet for each data collection, as it is useful for jurisdictions. So next, a subwork group came together to attempt to make the data from the study more actionable. So although the study is observational and non-interventional, we have collected several decades of information across the retail segment and felt it was a good time to help industry and regulators understand what some actionable steps may be taken to reduce foodborne illness risk factors. So 2 documents were created, one for industry, as you see here, and one for regulators. So we purposely wrote 2 separate documents to address the different needs of industry and regulators, since the action we needed these groups to take were related, but different in their own roles. So the call to action for regulators, for example, it's similar to the call to action for industry, but it focuses more on what regulations support proper date marking or disposition, and what resources are available for them to improve the evaluation of and better understand food safety management system facilities have in place for date marking. It also has information on how to help industry in developing better food safety management systems and explaining the principles behind the requirements and supporting procedures, training and monitoring that's being done. So all the materials that I mentioned in this presentation can be found by navigating to that first link on this slide. So we hope these new outreach materials will help industry and regulators reduce foodborne illness risk factors through the development of food safety management systems. The other link that's on this slide brings you to the Retail Food Study Food Shield database that I mentioned before. And this database is free for jurisdictions to use to collect and collate their data and does the analysis for you. So if that's something you're interested in for your jurisdiction, please go ahead and visit that site. And last but not least, this is just a friendly reminder that the Retail Flexible Funding Model Grant closes on November 15th. Now, for those that are interested or are in the process of applying, you can actually use the mentorship optional add-on to assist you with conducting a risk factor study and possibly observe a more experienced jurisdiction as to conduct their own data collection. Or if you have conducted a risk factor study before and are interested in mentoring another jurisdiction, you can also apply for funding to be a mentor. So this is similar to NACCHO's mentorship program. And it falls under as an optional add-on for the Retail Flexible Funding Model. So with that said, here's my email address in case you'd like a copy of the resources I mentioned. I'd also like to thank everyone for the opportunity to attend this conference and present. It was a great conference and I really enjoyed the topics presented yesterday and today.